Ever pondered why some children behave differently than others? Children, like adults, possess their unique personalities and behaviors. It's normal for kids to occasionally act naughty, defiant, or impulsive. But when these behaviors exceed the typical spectrum, they may point towards a behavioral disorder. From oppositional defiant disorder to attention deficit hyperactivity disorder, these conditions can significantly impact a child's life. Understanding these disorders is the first step towards effective support and intervention. Let's look into some of the most common behavioral disorders seen in children. Oppositional defiant disorder, conduct disorder, and attention deficit hyperactivity disorder are among the most common behavioral disorders in children. Let's start with oppositional defiant disorder, or ODD for short. Around 1 in every 10 children under the age of 12 may show signs of OD, with boys twice as likely to exhibit this disorder than girls. Typical behaviors of OD include anger outbursts, temper tantrums, and a persistent pattern of defiance. Next, we have conduct disorder, also known as CD. Approximately 5% of 10-year-olds may have CD, with boys outnumbering girls by a ratio of 4 to 1. Signs to look out for include disobedience, truancy, substance use, aggression, and even criminal acts. Lastly, we have attention deficit hyperactivity disorder, more commonly known as ADHD. This disorder affects around 2 to 5% of children, with boys being more affected. Symptoms of ADHD include a lack of attention, impulsive behavior, and hyperactivity that is more intense than their peers. These disorders may seem daunting at first, but remember, understanding is the first step towards support. Each child is unique and may exhibit different combinations of these behaviors. The key is to identify persistent patterns that interfere with a child's daily life. Now that we've understood the common behavioral disorders, let's look at the risk factors. Various factors contribute to the development of these disorders. Gender is a key player, with boys often more likely to be diagnosed than girls. Prenatal and birth conditions, such as premature birth or exposure to toxins, can also increase the risk. A child's temperament, if they're more impulsive or have difficulty controlling their emotions, is another contributing factor. The environment they grow up in, including high-stress family situations or learning difficulties, certainly plays a part. And lastly, irregularities in brain development can make a child more susceptible to these disorders. Diagnosing these conditions involves meticulous assessments by specialists, interviews with not just the child but also parents and teachers, and standardized questionnaires to provide a comprehensive picture of the child's behavior. Treatment approaches are multifaceted, ranging from parental education and family therapy to cognitive behavioral therapy and social skills training. More intense interventions may involve anger management or even medication. Remember, understanding these behaviors and providing the right support can make a world of difference in a child's life. To sum it up, we've discussed the distinction between typical behaviors and behavioral disorders in children, and explored common disorders like OD, CD, and ADHD, their symptoms and prevalence. We've also touched on risk factors, diagnosis methods, and various treatment options. We hope this video helps you better understand and support children with behavioral disorders. Stay updated on expert advice, practical tips, and effective strategies to support children with behavioral challenges. Don't miss out on the opportunity to gain valuable knowledge and make a positive impact on children's lives. Hit the subscribe button now to join our community dedicated to promoting children's well-being.